Namaste everyone and welcome to our Facebook Live session. Today, our discussion will revolve around a very important topic which is cardiac emergencies. And we are very honored to have with us Dr. Tejaswi and Marla, cardiothoracic surgeon and vascular surgeon at Apollo Speciality Hospitals OMR. With an abundance of expertise and experience, Dr. Tejaswi will be responding back to all your queries and concerns regarding this critical topic. Your cardiac health is paramount. Hence, let's understand why and how to care for it together. Thank you for joining us, Doctor.
Namaste.
To start with, Doctor, what is the meaning of cardiac emergencies? And when I say cardiac emergencies, what are the types of cardiac emergencies that we come across at Apollo OMR?
Cardiac emergencies are mainly in conditions where the patients already have a pre-existing atherosclerotic coronary artery disease, which when the patient has an thrombosis of that particular lesion leads to a complete occlusion of the vessel, leading to an acute coronary syndrome. So one of the emergencies is an acute coronary syndrome. The acute coronary syndrome might have an hemodynamic change where the patient might be in a cardiogenic shock, or patient might be having arrhythmia and patient might be having high heart rate without any cardiac output. So cardiac emergencies, we deal so many type of cardiac emergencies in Apollo OMR, out of which 90% of those are acute coronary syndrome.
So what are the common signs and symptoms of one of the cardiac emergencies that you mentioned, which is more commonly known as a heart attack?
The most common symptoms of heart attack are chest pain, which on medical terms we call it as angina, and the patient might have breathlessness, gasping, or patient might have palpitation, higher heart rate, and patient might collapse or have some what we call it as syncopal attack. So these are the four main symptoms which a cardiac patient might have, out of which chest pain might be typical or atypical. That is, typical is what we commonly see, the person holding the chest wall and wincing due to pain. Atypical is when the patient has pain in either hand or jaw, lower chin, the neck, and radiation to back, profuse sweating, or difficulty in breathing. These are all called atypical anginas.
So when you say typical and atypical, how do you differentiate between a heart attack or other chest pains or even discomfort for that matter?
Clinical symptoms pertaining to heart attack is like, you cannot differentiate it entirely by clinical means, like if the patient is having a heart attack or if the patient is having gastritis, we cannot just make it out by an clinical examination. We need to further subject the patient to either an ECG or an echo and then cardiac enzymes, after which we come to know whether it is cardiac or a non-cardiac pain.
Doctor, we often hear reports about young people suffering from heart attack nowadays. What could be the possible reason for this, and what are the measures that can be undertaken to prevent these sudden attacks?
See, the present day lifestyle is the one which is leading to all kinds of miseries these days with cardiac ailments. Yesteryears we had a healthy population which was mainly agriculture based population, so they had their lifestyle modified by themselves with their routine work, which is agriculture, and then on you don't need an additional exercises. But now we follow a lifestyle where most of us have a sedentary work life, so wherein the exercise or exposure to sunlight is very less. So these relate directly to coronary artery disease. So to prevent these, we have to have a healthy lifestyle, modify our lifestyle pattern and have a healthier lifestyle.
So when we see somebody suddenly suffering from the kind of symptoms that you had mentioned, that they're gasping for breath or they're holding their chest wall with a pain, excruciating pain maybe, what are the steps that as an onlooker, what are the steps that I should take if I witness a person experiencing these kind of symptoms?
You should be, cases of an heart attack, you should immediately take the patient to the next available health facility, wherein you can get a first aid and an ECG. An ECG to look at what is the form of an problem he is going through, if it is like heart attack or if it is gastritis. And in case if it is heart attack, the intensity of heart attack, the stage of the heart attack, you can make out from the ECG. So with that, you even the medical personnel as well as the patient can be ready for the next 4 hours of what the person has to do. So whether the patient has to undergo an admission and undergo certain tests, or the patient can comfortably go home.
So the first 4 hours are very critical and crucial.
Yeah, those are called the golden hours. So first 4 to 6 hours initially, whether it be a stroke or whether it be a heart attack, it's the golden hour. So addressing the patients in those few hours is very, very important to restore the normalcy of the particular organ.
Doctor, when it comes to arrhythmias, what are the common types of arrhythmias today and how do they affect the functioning of the heart?
The most common type is an atrial fibrillation. Atrial fibrillation does not cause a hemodynamic compromise as such. There is BP will not, you won't have a fall in BP, or the patient might not get giddy or things like that. So that only there is a rhythm change. But in cases of ventricular arrhythmia, if it is a ventricular tachycardia or a ventricular fibrillation as we call it in scientific terms, patient might have giddiness or even patient might have syncope, they might fall unconscious, and then there are times when we need to defibrillate them to get them back to life.
Are there any warning signs or symptoms that might indicate that the person is suffering from an arrhythmia?
The patient might have either palpitation or might feel entirely fatigued and listless. If the patient has a high heart rate, then the patient might have giddiness or complete loss of consciousness. If the patient has low heart rate, patient might have tiredness or listlessness.
Doctor, one of the most common or most searched keyword today is heart failure. So could you elaborate a bit about what heart failure is and how does it differ from a heart attack?
Heart failure is wherein you can distinguish as left heart failure and right heart failure. Left heart failure is when the heart's pumping function, that is heart has totally 4 divisions, out of which 2 are pumps, the left ventricle and the right ventricles are pump, and 2 right atria and left atria are the reservoirs. So whatever comes in the left atria or right atria is pumped to the body and lungs by left ventricle and right ventricle subsequently. So in this, when the left ventricular function comes down, either due to a myocardial infarction, that is a heart attack, or due to drug induced or because of some poisoning or anything, if the left ventricular function is decreased, then the heart might find it difficult to eject the blood forwards into the entire organ. So the deficit of blood which the heart is unable to pump to the entire body gets retained in the previous organ, that is the previous organ which gives blood to the heart is the lungs. So after lungs purify the blood reaches the heart. When the heart is unable to pump the blood forward, the blood gets retained in the lungs and it causes something called pulmonary edema, retention of fluid in the lung.
So when we say heart failure, what are the primary risk factors?
A low ejection fraction, comorbidities of course diabetes, hypertension and ischemic heart disease, low ejection fraction subsequent to that, and your heart failure because of other conditions like wherein you have a liver problem, there is an increased pressure in the heart due to asthma. So all these lead to the part of the heart getting dysfunctional. So the dysfunctional heart leads to something called heart failure.
Doctor, what is the role that stress plays today in terms of cardiac emergencies, and how can it be managed more effectively?
Stress plays a major role in cardiac emergencies, whether it be an acute coronary syndrome in case of an heart or stroke in case of an brain. So all these are because when the body is already having a diseased blood vessel, so when there is a stress, there is increased secretion of hormones which lead to the break in the plaque, the existing plaque, leading to thrombosis. So these thromboses occlude the vessel and which leads to low blood flow to the particular organ. So this is caused by stress. The stress releases the endorphins. So to reduce stress, you should follow a healthy lifestyle wherein yoga, walking, all these tries to alleviate the stress. I do not say that it can completely resolve it, but of course you can buy over it.
Which was precisely my next question. So, how do lifestyle factors such as diet, your exercise, your sleep, the number of hours you sleep, how do they impact heart health?
Sleep and diet greatly what manifests with the coronary artery disease. Patients who have a poor sleep, poor diet end up in having a very bad coronary health. That is all your present junk foods, as we call it, rich in polysaturated fats. All these leads to accumulation of bad cholesterol in your blood vessel, leading to your cardiac lesions, which further intensifies as atherosclerosis. And then even your sleep pattern, if you have a sleep less than 8 hours per day, there is a poor sleep cycle. The person is unable to cope up with this stress levels. It increases the body's response, stress response, which leads to increase in endorphin release, and the patient has subsequent cardiac ailments.
Doctor, today we see a lot of people who are fit, who are exercise every day, who maintain a very healthy lifestyle. They suddenly collapse. They suddenly have heart attack and they pass away. What is the reason, doctor?
That is because, as you mentioned, it is not just healthiness of the body. It is healthiness of the mind is also very important. Sleep gives that healthiness of the mind. When you say a fit individual, most of them gym for 1 or 2 hours but have sleep of only 4 to 5 hours. So that increases the coronary vascular risk. Most of these persons who have had young cardiac death while gymming, either in the gyms or in their workplaces, all these people have been found to have low sleep hours, and the low sleep hours are mainly because of the increased gadget time these days.
So, how frequently should one get their heart health checked, and what are there any specific tests that you would recommend?
An yearly checkup with an ECG and echo for people, patients below 40 years, and for patients above 40 years, I would recommend with the ECG echo, even a TMT will be a better option, because ECG echo will only tell us when there is a heart attack or an impending heart attack. It wouldn't tell us about the blocks, if there is any blocks or if there is going to be an occlusion of the vessel. That kind of stenotic lesions are only explained on a TMT when the patient's body is put to stress and then the ECG is taken.
Doctor, what are the medical advancements that aid in early detection and improved treatment of cardiac diseases today?
Nowadays we have something called HSCRP. This is highly sensitive C-reactive protein. Those tell us about the possibility of person having an myocardial infarction. So, and the patient's lipid profile, which says how badly his lipids are controlled, will let us know how early will the person be having a heart attack.
We'll take some questions from our viewers, doctor. Considering my family's history of heart diseases, what proactive steps should I take to lower my risk of cardiac emergencies? I am male, 41-year-old.
Usually there is a hereditary pattern for atherosclerotic coronary vascular diseases. So when a person has an heart attack or an coronary artery disease at the age of 71, you can expect the next generation to be having an coronary artery disease at a little earlier age group, like 50 or 60. So the patient needs to be either managing their lifestyle better or undergo examination every 1 year to see that they are cardiovascular risk free.
My husband suffers from high blood pressure and cholesterol. How can he effectively manage these conditions and prevent potential cardiac emergencies?
See, both these hypertension and cholesterol are comorbidities which lead to coronary vascular disease. So maintaining it in the good range is very important. Like pressure should be maintained below 139 by 89. That is what is the latest Joint National Commission accredited values which are suitable for a person who is already an hypertensive in a controlled state. In cases of dyslipidemia, it's better to have high density lipoproteins and have lower low density lipoprotein, triglyceride and VLDL. So to have high density lipoprotein, it is more dietary. So intake of flax seeds and intake of garlic pods will help you keep higher HDL levels.
What would be your message to our viewers today, doctor?
Healthy cardiac lifestyle is very important. So we ourselves spoil our cardiac health as well as our overall health. So to have a good cardiac health, maintain a disciplined lifestyle wherein exercise and diet are a part of your routine lifestyle and you don't wave them off in your run for your career and lifestyle. Thank you.
Thank you so much, doctor. That was very insightful. And viewers, for appointments with Dr. Tejaswi and Marla, cardiothoracic and vascular surgeon at Apollo Speciality Hospitals, OMR, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, doctor. Thank you, viewers.